on here and do a video about a topic that I keep seeing come up a lot, especially on a Facebook page that I've been watching. So there's a lot of questions, it seems, about the process in which you have to go through to be to get a surgery date, or I guess to be eligible for surgery. And from my experience, I've noticed that different healthcare programs, insurances, physicians require different things. So I kind of just want to tell my story because I haven't seen a lot of videos about the Kaiser process. And now I'm from Southern California, and it might be a little bit different here than it is at Kaiser's other places, because I also hear that there's differences between different Kaisers. So, you know, it's you kind of have to do the research in your area and with your physician. But I just wanted to at least explain or the process that I had to go through with Kaiser down here in Southern California. So initially, I had set up an appointment, with a bariatric physician through our health education program for preventative medicine, that's specifically through Kaiser. And that physician, based on your BMI, having to be over 40 or had to be over, I believe, 35 with a core morbidity. Hate that word. One of these days I'm going to get that down. So I barely hit the mark. When I went in at my highest weight, I was 276, and for some reason that day I had some weird high blood pressure thing going on, which I have never had a problem with prior to or since. And the physician that I saw gave me a core morbidity of metabolic syndrome. There it is. I had to think about that one, which I'm not really sure what that really is. I mean, who makes up metabolic syndrome? So my metabolism's bad. Yeah, I could have guessed that one too. I didn't need to have a diagnosis of that, and I didn't know that was an actual qualifying definition. But for me, that's what it was. Because prior to when I wasn't really looking into surgery, but had questioned that, they had told me that I wouldn't qualify because my BMI wasn't high enough and I didn't have any health issues. So long story straight, I was able to get this diagnosis and was referred to a 2-hour long introduction class to kind of go over the different types of surgeries and to see if it's something that you really, really, really wanted to do before you started a 12-week program that you have to do prior to being eligible for surgery. The 12-week program is titled Options, where I'm at, and the Options class is once a week for 12 weeks, and they cover everything from nutrition to vitamins to you know, what to expect afterwards and before, and you name it, we talked about it. And I kind of compare it to what everybody else kind of has to go through. What I've heard is that, you know, some people have to do one class here on nutrition and one class here on medication, and for us it's just an all-inclusive 12-week course of different people coming to talk to you. It's not individual sessions, it's actually a class setting. There was probably at least 20 plus people in my class for those 12 weeks. So once you go through that 2-hour course and you decide this is what you want, and you want to continue doing with the 12-week program, you let them know time and date that cycles every 12 weeks. Sorry, that was kind of redundant. So they'll call you and ask you if this is an available time for you, and if it isn't, then they'll tell you that they'll call you back when a new cycle starts. Luckily for me, when my first one was offered to me, it worked out for my schedule. Now they do also say that if you miss a class, you have to make up that class, and if you don't make it up, then you don't pass the class, and you kind of have to just start all over. So you don't want to miss. So you want to make sure that that class and that time schedule, excuse me, works out really well for you. Because if you miss, you kind of have to start from square one if you don't make it up right away before the next class. Sorry, I didn't mention that. You have to make it up before that following week. So if you get behind, they don't let you make that up, and you have to start all over, and it sucks. And there was a couple of people who had to drop out of the class, and it was very, very bad. So, so once they call you and you start your 12 weeks, you go through your 12-week program. Maybe one of these days I'll do a video on all the documentation that they provide in the education, but pretty much it's kind of the same place anywhere if you go through these educational courses or get that thick binder from your surgeon. It's all the same stuff. It's pros, cons, the good, the bad, the ugly, and recommendations and all that stuff. So for me, once I finish those 12 weeks, they inform you that you have to see your bariatric physician once more. I'm sorry, I forgot to mention that. The third week in your 12-week program, you have to meet with your bariatric physician. And this is not the surgeon, this is just the physician, and they review your lab. So again, I forgot to mention this also, I apologize, I'm kind of going backwards. Within that first 1 to 2 weeks of the course, you are required to do your lab work and your stress tests, EKG, all that fun stuff. So I had to do a chest x-ray, an EKG, I had to do a stool specimen, and a blood drawn. I think they took out like 20 valves of blood. It was a lot for all these different things. Sorry I don't have all the names, and maybe someone else could provide that to you, but I wouldn't even be able to tell you or where to start. It's a lot of stuff. So that has to be done within the second week of your classes, so that when you meet with your bariatric physician in the middle of your 12 weeks, I am so sorry. I'm kind of just shooting this from the hip. They review all your labs, make sure that your levels are where they need to be. If they need to do some interventions with extra vitamins or whatever, they'll let you know at that time, so that at the end of the 12 weeks, you are ready to go and there's nothing keeping you from getting things done. So for me, when I hit the 12 weeks, or excuse me, the third week mark, went over my labs, my labs were great. The only thing that I was deficient in was vitamin D, which is actually very, very common. So they put me on this super, super high potency vitamin D for, I think, 3 weeks, where I had to take this one high dosage pill once a week. And other than that, I was good to go. So after that time period, at the very end, you'll see that bariatric physician again. They'll kind of, my physician actually did a physical exam at that time, also reviewing my goals and if I was still really willing to go through with the surgery. And they did a physical exam, just a regular physical. They check your stomach, they check your breathing, just the typical kind of stuff. And then after that, they had you do a psych eval. So you have to see, I don't know if she was a psychologist or a psychiatrist, but I know it was a psych eval. And they want to make sure that you are prepared for what you're getting into. But not only that, but to determine if you have any type of past depression or current depression concerns, or any type of addictive issues, that they address them right then and there. Because once you have the surgery, those are going to get expressed 10 times worse. So if you have depression, the surgery is going to have have you get even worse depression. I'm sorry, that was bad English. If you have depression, your depression is going to get worse. And it's pretty much guaranteed, because they tell you you're probably going to get depressed. Even if you don't have depression, you will probably end up being depressed. You will probably have those thoughts where, why the hell did I just do this? And it's very, very common to think that way. So they want to make sure that you are in a stable mind and mentally prepared for what's going to occur after surgery. Same thing with addictive personalities or having addictions in the past or present. The risk for having addictions is super, super high, because you won't have that relationship with food anymore, and you will attempt to turn that into something else. So after the site clearance and your bariatric physician clearance, you get contacted by the surgeon. So by the time I got cleared from my psych and my bariatric physician, it was probably about 3 weeks, and I was scheduled for a surgeon consult, which I actually just had last Friday. So well, with your surgeon consult, he kind of does the same thing. So when I went in, they did this questionnaire about all your health history, any current symptoms of any kind, and then they kind of go over habits to determine which surgery is best for you, which I'm just going to go on a little tangent. So he asked me this one question, which was if I have a high craving for sweets. And I don't think I have a high craving. I do crave sweets every once in a while, but usually now that I've changed my eating habits around, I will go for a yogurt. I will go for a spoonful of peanut butter, and that keeps me from grabbing a candy bar or ice cream or cookies or whatever. But he had told me that if I do have large cravings for sugar, that he would recommend the bypass. Because with the bypass, when you eat sugar, you're more likely to have dumping syndrome, and the dumping syndrome would be a lot worse with the bypass than with the sleeve. Because he said that some people who have the sleeve and eat sugar don't even get dumping syndrome. So that it doesn't change that habit, because, you know, you're trying, not that you want dumping syndrome, but you want the surgery to work towards you. So work for you. So if you do eat crap, you want your stomach to react in a way that makes you not want to eat that way again. So the dumping syndrome, even though you don't want it, kind of plays in your favor, because once you experience it, you never want to eat whatever you just ate that caused that. So he was trying to tell me that if it was an issue, that I should get the bypass. Well, I am determined to get the sleeve. I don't want to mess with the physiology of my body more than just removing the stomach. I don't want to bypass anything that's just, I didn't want to do that. So I reassured him that my sugar craving is under control and it won't be an issue. But just to kind of let you guys know that that was something that was kind of caught me off guard, I guess you would say. Anywho, so once they determine which surgery is best for you, he scheduled my surgery within 5 weeks. So my consult was on 10/10 and my surgery is scheduled 11/20, and it's 5 weeks. So he was pretty busy, he said, so I don't know if it's normal to be 5 weeks out once you get your clearance from your surgeon, but I was okay with that. It was quick enough for me. I still have a lot to kind of get together, so yeah. So all in all, I started my journey in June of 2014 with taking my classes and doing everything that I needed to do, and my surgery is now scheduled November 20th. So what is that? 6 months? 6 months? 7 months? 7 months? No, 5. do math, it's like 5 months, 5 and change, depending on when I started in June. So really, that was really, really quick if you think about it. I, you know, look at other people's journeys with this and their process that they had to go through, and some surgeons demand a lot from their patients prior to. I just read just recently, and why I'm doing this video, about how the patient had to write a 10-page paper on bariatric surgery and then had to talk to 5 previous bariatric surgery patients and have them sign off on a form. It's just, Kaiser doesn't do that. Okay, that was just a little much. You know, this isn't like going to school, okay? I guess, you know, it's a good education process, but OMG, I don't know if I would be willing to do all that paperwork and sign off from these straight whatever. I mean, the only outside source thing that Kaiser made us do, which I'm sorry I failed to mention until right now, is that we had to participate in one bariatric support group, which I'm actually grateful that they did, because I go to that support group now monthly and I love it and they're awesome, and I am glad that Kaiser made me go to one. I mean, I love support groups. I believe in support groups already. If you watch my previous videos, I talk about how I quit smoking and how I went to good support groups to do that. And so, you know, that part's great. But, you know, going out into the community, especially with bariatric patients, there's such a huge community of us. So I say, if you haven't, please reach out to your community, because they're very, very helpful and very, very knowledgeable. So I know I keep rambling, and I apologize for the lighting right now. It's gotten really, really dark all of a sudden, and it's only 6:30, and this time changing thing and this weather, everything's changing, and I apologize for the lighting. So I guess I'm going to end it there. I mean, if you have any questions that I didn't get to, please write them down, leave them down below. I am more than willing to answer anything. I love feedback I get from you, and it really means a lot to me. So yeah, so I will see you guys again hopefully soon, and I'll give you guys an update. And I'm sorry for the blackness, this is ridiculous, and now you can't see me, so catch you later. Okay, bye.